Good morning, everybody. Good morning. If the last couple of people could just take their seats, because we are now connected with 8 other events that are very much like this that are happening elsewhere in England. I'll tell you all more about that in a moment. I'm Vicky Cook from Opinion Leader, and big welcome from me to you all. Thank you very much for coming out. I know some of you have struggled with some difficulties with public transport, so we really, really appreciate you being here for what I hope will be a really interesting and lively day. So welcome to everybody. There's more than 1,000 people taking part in today's debate around the country. Can I make a request to everyone to turn off their mobiles at this point, because we have a lot of technology connecting the sites and mobile phones can interfere with that. So please could you all turn them off. You'll have opportunities later in the day to open them. But why are we here? We're here because the government is currently running a wide-ranging review on the future of health services in England, and this is a really major piece of work to involve people, whether you're patients, whether you're citizens and the public who aren't currently patients, or whether you work in the NHS, and you'll hear more of that in a moment. Opinion Leader has been asked to bring people together to understand and listen to your views and to make sure that they're taken into account in shaping the future. Some of you have already participated in an event like this back in September, and to those of you, thank you for coming back, and some of you are joining us for the first time today. So what we'll be doing during the course of the day is telling you a little bit about what's happened since September and some of the emerging ideas and themes, and you'll be hearing about what's happening in your region. So a lot of this has been worked out specifically about your region, so more of that in a moment. But the purpose of today is to really help the government and the Strategic Health Authority to shape plans for the future of all of our NHS. So it's a big event. In a minute I'll explain what's going to happen in more detail. But let us first of all just see who's here from around the rest of the nation. We have 9 events happening today. We are in Nottingham, and we're what's called the Hub event, and I'm very pleased that we have Professor Lord Aradazi, who's leading this review, who'll be talking to everybody in a moment, and David Nicholson is also here, who's the Chief Executive of the NHS, as well as the clinical leads from the Strategic Health Authority, more of whom you will hear later. But the other sites around the country, we're going to just have a look and see who's here. So going around the country, and you'll see other people in rooms similar to this, and perhaps as I mention each location, they could all give us a wave so we know who's here. So we're in Nottingham, but then in Bury St Edmunds we have a similar number of people, so I think they're waving in the darker one. In Bridgewater we have people, in York, in Gateshead, in Birmingham, in Reading, in Tunbridge and in Bolton. So we've got lots of people who don't seem to be waving very much, but we'll be hearing from them later on, because during the course of the day we'll ask each location to tell us a little bit about what's happening there, so we all know that we're shaping the whole NHS as well as our own regions. But without further ado, what I'd really like to do is to welcome Professor Lord Aradazi, who's chairing this review, to come and tell you a little bit about what he's hoping we're going to achieve through this and what he's hoping to achieve. So please can we welcome Aradazi.
Thank you very much. Well, firstly, thank you all for taking the time again to be with us today. Some of you were with us on the 18th of September. May I also take the opportunity to thank many of you who are here for the first time. If I could put this within the context of why we're here for the second time. Most of you remember in July the Prime Minister and the Secretary of State launched the NHS Next Stage Review. The whole purpose of this review is to engage with the patients, the public and the staff within the NHS in designing where the NHS is heading over the next 10 years. What's unique about this review, as most of you will remember on the 18th, is unlike a review being cooked and designed in Whitehall, where I am 3 or 4 days a week, it's actually designed at a local level. It is an engagement between the clinical staff and other staff who work in the NHS locally with the users and the public locally. That is very different than any other review we've ever seen actually in the history of the NHS. We captured many themes and challenges facing the patients and the public locally on the 18th of September. Most of you will know that on the 4th of October we published an interim report which we set the principles in which we see the NHS moving over the next decade. And the principles were one of the most important values of the NHS, equality. We talked about personalised care, which is what patient told us on the 18th. And then we talked about the two, probably the most important principles in the next decade, and that is the safety and the quality of care. Now, some of you might be aware, after we capture some of your thoughts, on the same day, on the 4th of October, we launched so-called the clinical working groups. And there are 8 of these across 9 different regions. There are 1,500 clinicians who've captured your ideas, who've been working extremely hard. And if I could acknowledge the amount of hard work they've put into this up till now, and today it's our opportunity to share with you some of their early thinking. I'm as excited as you are because I don't know what the thinking is locally, so I'm here to listen from the 10 regions, what are the challenges and what are the opportunities over the next 10 years. So that's the theme today, and that's what we need to share with you, but at the same time capture with you some of the other challenges since the 18th of September. So if I could re-emphasize again, what we're going to listen today is locally. What are the challenges facing you locally? What are the solutions to some of these challenges? And the principles of the clinical working groups, the 1,500 clinicians, is the way NHS and healthcare delivery in the future will be based on clinical evidence, it's going to be clinically led, and it has to be patient-centred. I think I said enough about this. I'm going to introduce you now to the Secretary of State, who very kindly has taken time to talk to all of us across the country in the 9 different regions who are all interlinked. And without any further ados, Secretary of State Alan Johnson.
Well, good morning to all of you. I'm sorry I'm imprisoned here in Whitehall for various reasons, one of which, incidentally, is that we have to ensure that MPs' pay today is on exactly the same basis as we've asked NHS staff to accept, so a stage pay award under 2%. But you've got people around the country involved, many of whom have been involved before, lots of you will be involved for the first time. This is a unique review. It's being led by Professor Lord Aradazi, who's there with you in Nottingham in the East Midlands. And just to remind you, Aradazi is one of the world's most renowned surgeons. He pioneered robotic and keyhole surgery. We brought him into government, into the House of Lords, and then as a minister in the department, to lead this review with his colleagues, because what we've said is we've had enough organisational change in the NHS. There's going to be no change to strategic health authorities and primary care trusts. All of that organisational stuff we can put to one side. We've increased capacity enormously. The amount of money going to the NHS, into the NHS, was £30 billion in 1997. Now it's £100 billion, and in a couple of years' time it'll be £110 billion. So lots more investment, lots more capacity, new hospitals being built all over the country, new equipment, more doctors, more nurses. How do we now move to the next step? Leaving aside organisation, as I say, and concentrating remorselessly on how we can have a clinically led, locally driven NHS. It's important because with advances in medical science and new technology, there are so many opportunities now. On the one hand, the opportunity to specialise much more on issues like cancer, stroke care, for instance. On the other hand, the ability to do more things locally in the community. And so as Ara has said, you centralise where necessary, you localise where possible. But these are buzzwords and it's jargon. What we really want to do is to work with people in the NHS, with patients and the public, so that they have a genuine input into how we look to develop the NHS over the next 10 years. The interim report on this review was published last September. It talked about a fair, personalised, effective and safe NHS. That was some of the initial thinking that was the result of the early input. Now we can move on to the next stage, as Ara says, with those 1,500 clinicians right around the country, centred on how we do this in each location. If we want the NHS to be clinically led and locally driven, it's no good us having events in London and just concentrating on Richmond House. We have to get out and do this around the country. Final point I want to say is the other huge importance of this year is that it marks the 60th anniversary of the NHS. Created in 1948, a huge advance, but a very centralised system, because that's how things worked in 1948. Nye Bevan, many ways the architect of the NHS and the health minister in 1948, famously said that if a bedpan falls on the floor in Tredegar, which was in his constituency in Wales, it should echo around Whitehall. Well, I don't know whether bedpans fall on the floor in Tredegar anymore, but we certainly don't want that kind of level of centralised, almost a benign dictatorship in relation to the NHS. The NHS is world-class in so many respects. It's hugely valued by the public, no matter what stories are thrown at it, and there are teams of journalists whose job is simply to go and find out a bad news story, and given that we treat so many people in the NHS, they'll always manage to find them. But the experience of the vast majority of people who come into the NHS is one of absolute respect for the staff and for the care that they receive. And as I say, the NHS is really a valued institution in our society. How can we celebrate the 60th anniversary in a tangible way that means that the public, patients and staff have been involved in setting the course for the next 10 years and beyond of the NHS? I'm enormously grateful for your contribution. You know, this is not an easy task, and there'll be lots of questions and lots of responses you'll need to give, but it's a very valuable way to ensure that we end up with the kind of NHS that we want to see, in which the public, patients and staff really feel they've had a role in shaping. Have a good day.
Because we're going to hear back from some of our colleagues in other parts of the country, but I think on acute there was a sense that people were really behind the proposals, absolutely agree that stroke should be a higher priority and that people should be taken straight to a specialist centre. But inevitably there's a question asked about, well, where's the money going to come from? So how are we going to deliver it? And I think on maternity, a real sense that people are very pleased that it's going to be more focused on the woman and treating every mother-to-be as an individual rather than perhaps a number or a risk assessment. Again, question, do we have enough midwives to really make that work? So I'm going to now hand over and bring in some of our colleagues from around the country to hear what's been happening there. So first of all, I'd like to go over to you in Bury St Edmunds.
Thanks, Vicky. You can hear we've got a really full room here today, and it's a gorgeous day outside, having very lively discussions. I think just hearing some of the national results there show that actually there's really kind of consistent themes emerging. Just in terms of some of those figures, that there are some things here, I think, in the east of England that are seen as really fundamental. And one of those is the importance of patient-centred care, with 83% of people here saying that it's very important. So kind of 8 out of 10 people taking part today thinking that's an absolute priority, to treat people as individuals and not just to treat their symptoms. Equally, I think we're kind of matching the national picture here in terms of getting the basics right. 73% of participants in the east of England think that that's a priority. Just commenting on some of the kind of pathway discussions that we've been having this morning, just a couple of points really, so not overall conclusions as yet. In terms of maternity care, similarly support for, I think, for choice in terms of maternity and the place of care, but also support for midwife-led services. On the acute pathway, I think some of the feedback was a real emphasis on the importance of training paramedic ambulance teams so that they can be really involved in the diagnosis stage, so not waiting to have to get to A&E before that happens. On planned care, also a training issue that's come up, which is about training for GPs so that they can help people to make choices, so that GPs themselves are kind of trained up to support people to make the right decisions. And then lastly, the fourth pathway, which we've talked about, which is children, a really a kind of important point, which is also providing care for NHS staff and others who are looking after those patients, so the young patients, because it can be quite an emotional experience. So there are a few highlights from Bury St Edmunds, and back to you in Nottingham.
What's interesting is because everyone's been working with slightly different ideas that have been evolved in their regions, and it's quite interesting to hear some of the new ideas. So thank you very much for that. Let's see what's going on in the southwest now and go over to you in Bridgwater.
Very warm welcome from everybody here in Bridgwater. We've been having a fantastic discussion this morning, very wide-ranging, not everyone agreeing with everything, which of course is the heart of a healthy debate. Similarly, though, to the national picture, we absolutely believe that it's very important that the NHS treats me as a person, not as a symptom, and that actually the basics should be right. And I think these two really important things actually then lead into a number of themes that have come through from discussing all the different pathways. And the first theme is one of speed. And for acute care, that's speed of treatment, getting the stroke treated straight away. For planned care, it's actually speed of diagnosis, making sure that those diagnoses that go through quickly. For children, it's actually speed of treatment again. So speed is a very important thing. We've also talked about the importance of relationships in all the different pathways, whether that's with the midwife, whether it's with GPs, whether it's with key workers, and the school nurse was talked about at great length, and the role that they have to play in developing those relationships. We've also talked about the importance of choice and how important it is that people have choice, and the groups that were talking about maternity absolutely applauded giving choice to future mothers. We do also have some concerns, big concerns about money, big concerns about staffing, but some very, very positive feedback on the issues we've discussed so far. We're looking forward to the rest of the day, so back to you, Vicky, in Nottingham.
Yep. Right. I think we're on, no? Are we online? Yes. Okay. Great. Hi from York. Sorry about that delay. The racecourse here may be flooded, but the sun is shining, and we've got 102 staff, patients, and public here debating the new ideas for care pathways. There's substantial support for some of the new ideas for the care pathways. And in some cases, people feel that some of these changes are already in place, for example, in some aspects of planned care. But there's also a sense that there will be a lot of challenges to achieving some of the changes that have been proposed. Some of the highlights, we have three key themes really coming out from York. One of them is around specialist centres, especially for urgent care centres for children and strokes units. And people say that they would be happy to travel, but perhaps not too far, but where really good care is available, people will go to it. Another really big theme is about empowering patients so that they've got more information and knowledge, information through about their conditions, about knowing where to go, about what's available where. And this can be also given through IT, and one nice example is perhaps sending out text messages to parents if there's a bug or a virus going around their school, so they can know to avoid sending their child into school that day. And also empowering people by giving them peer support, especially this was talked about in the birth pathway, maternity care. And finally, speed of treatment, which came out as well in Bridgwater, but top voting in the acute care pathways for CT scans for stroke victims and quick diagnosis of conditions for planned care. So that's all here from York. Back to you in Nottingham.
Thank you. I think there's going to be some very happy children in Yorkshire and the Humber being kept out of school when there are bugs and viruses going around. Does that apply to those of us who are working as well, I wonder? But thank you for that. And we're just going to hear from one more of the regions at this session. So over to you in the northeast at Gateshead.
Hello Vicky, welcome to the Baltic Centre here at Gateshead. We've had an interesting day. Apparently there's been a small flurry of snow outside as well, so it's all happening. We've also had a number of interesting panel question discussions going on. But one of the sort of key themes again that I think Katrina mentioned earlier is sort of being the real patient-centred care is absolutely key, and giving people that empowerment. In terms of looking at some of the pathways that we've discussed, when we talked about maternity care, this is particularly about information and communication, preconception, advice and information, but some interesting ideas about during pregnancy support by people understanding that condition almost like a mentor in the community, so moving much more of that information and provision out to the community. In terms of acute care, we're looking at some people are actually beginning to raising the idea about avoiding A&E and hospital admissions where possible, doing assessment and diagnosis over the phone, and sort of there is this appetite for telephone services such as the 888 and the NHS Direct, but at the same time some people do report some worries over resourcing those services. Moving on to planned care, there is a lot of support for the idea of the one-stop shop. People have talked about that quite consistently, and reducing the number of times people do go into hospital. So some of the ideas that have been coming through from the interim report is getting quite a lot of support here there. But it's moving services out locally, or even better planning those appointments and booking in blocks. And finally, in terms of children, we return to that theme of being patient-centred. Real understanding on people, a real focus on people understanding the process that they're going through, and understanding that this is not just about parents, but it's also about the children themselves. So there's almost that sort of two-way communication. You're talking to the parents and the children about the process. So, as I say, I'm sure we'll have a very interesting afternoon. Back to you in Nottingham.
And I'm glad that you're all having really good discussions. We're now all going to go back to our own local discussions, but we'll be seeing you all later, so thank you. Thank you all very much. And we're now, I think, connected with everybody else around England, and I hope you've all been having equally as lively discussions. We've just had a very lively discussion about smoking cessation programmes, and what I want to do is to straight away go over to Birmingham to hear what you've been saying. So over to you, Birmingham.
Across the other locations in England from Birmingham, as you can hear, we're having a lovely time here today. We've got 110 people in the room having some really good conversations about the pathways. I wanted to just say that there's a really clear theme coming across from a lot of our discussions about the need for kind of support and personalised support for people across a lot of different pathways. But that came through really clearly from the discussions about staying healthy, that there's a real need to provide support for people both sort of before, during and after they're deciding to make a lifestyle change. So intervening early, supporting them through the change, and then helping them to maintain certainly seemed to be a key piece of feedback from some of our tables. And making sure that's one-to-one and face-to-face, and that choice is available where possible. And choice and variety was also a theme that came out very much in the discussions about mental health, the need to provide people with options beyond medication, both in terms of the sort of services that the health sector should be providing, and also making sure that care is holistic and draws upon support from other sectors such as housing advice too. And ideally to do all of that quickly, because there's a real theme about speed as well coming through. And just to reflect on what one of the participants here said, is that some people just lack that emotional support in their lives and really benefit from encouragement to stay healthy, both physically and mentally. So I think that's a good, clear message, and back to you in Nottingham.
Thank you very much from the West Midlands. I think you're physically the closest, but it was slightly slower to link up with you, so we really appreciate your contribution. Thank you very much. What we're now going to do is to head further south and hear what's happening in Reading. So over to you, Reading.
Thanks, Vicky. We've also had a very good day, lots of similar themes, including to what Liz has just said. In addition, people really believe in prevention here in terms of staying healthy. A lot of ideas very popular there, including the most straightforward and simple to implement ones. They're also really keen to see partnerships, including the involvement of the voluntary and community sector, as the Macmillan nurses example showed. Also very popular offering services closer to home in a community setting, the proximity being very appealing, and the option of having a one-stop shop. And as Liz also picked up, mental health, a big theme. People want to see it prioritised, the stigma addressed, early identification and treatment, including non-medical interventions like counselling. So that's about it from us, and back to you in Nottingham.
Thank you very much. Two more regions that we haven't yet heard from. Let's first of all go to the southeast coast. So over to you, Tunbridge.
Hi, Vicky. We're having a good time down here, as you can hear. I think we've probably picked up a few themes through the afternoon discussions, and I'd probably share three major themes with you. The first is, similarly to some of the other feedback, patient choice and being treated as a person, and I use that term rather than personalised care, but treat me as a person, as an individual. Examples of that, for example, on the long-term conditions, is about empowering people to look after themselves, to treat and test themselves to some extent, or with end of life, giving people choices about where they die. I think the second theme has been about early planning, prevention and education, and I think a particularly strong message about education on mental health, I think perceived here to be an issue that isn't talked about very much, there isn't much education about, and that's a real gap potentially in terms of a health education issue. Also, in terms of early planning, that would be around the end-of-life services as well. You know, agreeing a plan at the beginning when somebody's going through those last stages of life with the family and with that person, and then sticking to it. And the last one is really about a bigger picture, both joined up services in terms of different services joining together, but also in terms of looking at the bigger picture of a person's own support network, not treating them just as an individual, but considering their family and the other support they have around them. So people here talking about, on staying healthy, it being a whole family education programme, and on the mental health side, joined up services being particularly important message coming back from the discussions here on that. So I think that probably sums up the main themes coming out here in Tunbridge this afternoon. I'll hand back to you in Nottingham, Vicky.
Thank you very much. And last but by no means least, let's go to the northwest and go over to you, Bolton.
Hi Vicky, yeah, we've had an okay day here actually. It's been all right, hasn't it? Yeah, 107 of us here, although I'm sure it sounded like there were more from that. Some of the key distinctive things here, patient-centred services, a little bit like Rachel's point, coordinated services and communication. I mean, that seems to be the holy grail here. Some of the distinctive things would be around screening for wider health, observation that we have dental checkups. Why don't we have wider health checkups periodically? And a focus on education so that spot health problems early and things don't necessarily develop so that you need medical interventions. On the pathways we've been discussing, in terms of long-term care, a desire to involve families as well as the patient so that they're well placed to look after them because they're often the carers. At the end of life, key issues around that, clear procedures, and one big hurdle that was mentioned that perhaps we all need to, as a society, need to become more comfortable about talking about the end of life. With mental health issues here, strong focus on early and rapid diagnosis, particularly around dementia and support for carers of those who have dementia, particularly those who are bereaved once the patient has died. And then finally from us, some thoughts on staying healthy, the view that the NHS can't do it on its own, and there's a desire to see more resources diverted towards prevention and staying healthy. So that's it from us, and back to you, Vicky.
Thank you all. I think some of us need to have our hearing tested after that rather loud cheer that woke everybody up. We all jumped in our seats. But thank you very much. Some really interesting, I think, some consistency, but also some differences emerging around the nation. I would like to ask Ara Darzi to come back. You'll remember that Ara is chairing this whole NHS review. He's been with us in Nottingham all day, and I'd like to invite him back to make a few comments to close the national debate. So, Ara.
Thank you, Vicky. Thank you all across the country. I've had a fantastic day here in Nottingham. I hope you've had. I'll tell you what I've done all day. I've spent the first half of the day talking to colleagues in the media who had a tremendous interest in what's happening here. What's this story about engagement? And in actual fact, I had to say that it is probably the first time that we've ever done something like this. And I'm saying this to you as a clinician. You know, it's interesting, as most of my clinical colleagues would agree here. You know, when you see a patient, there's always a sort of a one-way conversation. You're talking about the diagnosis, you're talking about the treatment. But actually being able to sit around and have a discussion with the patients, the users, the public who fund the service. Let's not forget, it's actually the taxpayer, the public who are funding the service. This is a very, very unique and a very, very different experience. It's an experience that I've learned recently when I was a clinician doing a piece of work in London. But it's an experience I have no doubt, if we are to think about the next 10 years in the history of the NHS, in the next 10 years and what's going to happen, is this process has to continue. The only way you're going to learn how to improve a service is to talk to the customer. And the patients are the customer of the service. And I said this, as I said, as a clinician, this is not a one-way conversation. This has been a two-way conversation. So it was an interesting morning. I also ended up taking, one of my colleagues in the media decided that they should take pictures of me, so I spent a lot of time in different poses in front of the camera. One of the disadvantages of doing the job that I'm doing at the moment is the picture side of things. But anyhow, then I joined the afternoon and I went around the tables and I really picked up a lot. The long-term conditions one was the striking one, where it is quite clear, if you look what's going to happen in the 10 years, and again, I'm sorry to remind you back, this review is about what the NHS and where the NHS is heading in the 21st century. As Alan this morning referred to the Secretary of State, that we are approaching the 60th anniversary of the NHS. Long-term condition is going to be one of the biggest challenges to the NHS over the next 10 years. We are all going to live longer. That's a good bit of news. But if you're running a health service, you need to be fully equipped to deal with a population that's going to live longer. In one way, it's a reflection of the innovation that's happened in medicine over the last 10 years that are keeping us live longer. Cancer was an acute illness before. We lost patients very quickly. Cancer now has become a chronic illness. You can live for years and years and years with cancer. So, I think I've captured, and as most of you have, and I have no doubt in the other regions, is that that technology that's keeping us alive longer, there are also other technologies that are also allowing to transfer care, not from a hospital setting, but in the community setting. And we've seen examples of that, one of which was the 80-year-old patient who probably had an unstable angina, and how could we manage her within a community setting. The other issue about long-term conditions, which is also going to become more challenging, is the fragmentation of care, because the wish, as we've heard, integrated care. So I think one of the areas that there's been a lot of enthusiasm about, and we captured that from others, has been the personalized budget, the patient being able to have their own budget in planning the care. One thing also you realize as a clinician is that those who have chronic long-term conditions actually become an expert in that illness. In some instances, they meet staff in the NHS where the patient has more expertise than the person actually seeing them. So we need to obviously work on that and make sure that we empower the patient from the long-term conditions. I sat at another table with mental health. Again, I was reminded, you know, I think I'm a surgeon, surgery is everything about medicine, but in actual fact, 1 in 4 of us sitting in this room will have a mental illness at some stage in their life. And we've heard stories. Spike Milligan was referred to on one of the tables, and the treatment he received, said in a very jokingly way by Spike Milligan himself. The importance of well-being. Well-being isn't just physical health, but it's also mental health. We've heard wishes from different tables that mental health isn't just about drugs and therapy, it's about counselling and supportive therapy. Again, very much in line in what of the different groups have been thinking and what the different parts of the country are also talking about. I've heard some very radical views about smoking, which is obviously interesting, but I could see where you're coming from. I think one table articulated prevention is better than cure, and that is where we need to start. At schools, we need to start learning within not just the NHS, but with other departments, schools. How could we introduce prevention? How do we, I think one group said, how do we stop making smoking cool? How could we reverse that? How do we put positive incentives in kids in schools? And so on and so forth. I've also heard something new today, which I haven't heard of, from the end-of-life pathway, GSF. Never heard of that before, but I could capture that. I think that also highlighted what's important about the wishes of the patients approaching their end of life is to die at home with their family and their loved ones. And how do you coordinate that? I sat certainly on one table, we were talking about the pathway of Ernie, and I remember Eric, who was very, very vocal about the way we're treating patients now when they come on the end-of-life pathway, which is to call 999, end up in a hospital setting, when in actual fact, once you discuss the new pathway, which is to have a telephone line that the family are aware that the patient is within their end-of-life pathways, to contact that number to get a coordinated service. What's unique about the end-of-life thing is that it's not about money, it's not about resource, it's purely about coordination. And I think another idea there was society needs to be more open to talk about end-of-life. I think us as clinicians, we also need to be more open about talking about end-of-life. There's something about us in there that when we see a patient who are approaching the end of life, we always want to give them something to say, we can actually keep this going longer and longer. And I think we need to be more transparent in our discussions with the patients. What I captured from the video links, I think we are on the right track. Personalized care came up again. Choices of treatment. Not every treatment is surgical. Not every treatment is drugs. A lot of treatment is counseling and support. The holistic way of providing treatment, which is one of our strengths in primary care, which always provided that wonderful holistic approach to care. That came from West Midland. Reading, talking about prevention again, and I think one of the big themes, if you're really talking about 10 years from now, we talked about long-term conditions, but I think, as the Prime Minister said earlier, I think the first week actually in this year when he made a speech, there's a major theme in changing the NHS from a sickness service into a health service. In other words, prevention, primary prevention. And how do we work with other stakeholders in making that happen? Tunbridge, respect, dignity, which is back to what I've heard in the past. Again, bringing back the personalization of care. And personalization is just not individual care, actually treating the individual with respect within the context of their family, but also in their community. And finally, what I heard from the Northwest, which was about communication, coordination, which is what we talked about this morning when we looked at the different animation. Remember the different lines where the right hand didn't know what the left hand is doing, but in actual fact, both provided an extremely competent service. And I think that's a reflection on how complicated healthcare delivery is becoming. The more complex it becomes, we need to simplify it and coordinate it from our end. So what's going to happen next? I think I touched on the point this morning that what's different about this review, it is led by clinicians locally, clinicians who are and NHS staff who are working to deliver healthcare in the east of Midland or west of Midland or across the country in the 10 different regions. That is what's unique. So if there are any expectations that I'm going to come up with a report, I'm sorry to disappoint you. It is your report. There are 9 reports coming from the 9 regions because the 10th has done it already. What we're trying to do is to capture from the staff and the clinical colleagues in this room what are the tools they need to make that vision into a reality. Because one of the most disappointing things that disheartens staff is that we're producing another report which is not actually going to deliver the goods. So what we'll be doing is to capture these ideas and, more importantly, find out from you here what are the obstacles, what are the tools that they need to make this vision become a reality. So after all these reports are published, we will publish a supplementary report essentially just to empower the staff and devolve the power that they need to make that vision happen. So I've had an extremely enjoyable day. I've learnt a lot. I've captured a lot of ideas. One thing I want to do on your behalf, and I'm saying this on behalf of the patients and the public here who's sitting in this room, is that the amount of energy and the enthusiasm that the NHS staff and clinicians have put in making this happen. And I could promise you one thing, whatever I do, taking this break out in my clinical practice to make this happen is to make sure whatever we can do is to empower them to deliver the vision that you're aspiring to into a reality. So thank you very much again.
Thank you very much, Ara. Thank you to all our colleagues in the regions. We're going to go back and close out locally now. So I hope you have a good rest of the day. Thank you all very much.